Women from across America have come to Los Angeles on what a few years ago would have been considered an impossible mission: to eradicate the disease of cervical cancer and HPV. It is an ambitious undertaking because, sadly, 4,000 women die of cervical cancer every year in America, and 11,000 new cases are diagnosed. But cervical cancer is a preventable disease, and the goal of the National Cervical Cancer Coalition is to help women lower their risks. Casino Night is a fundraiser to spread the word that today women can beat the odds.
I think if we can get this message out to women to learn more about how they can educate themselves against HPV, and cervical cancer, and prevention, I think we can do great things for this country and women across the world.
We hope to empower women and not let them be ashamed of having acquired the HPV virus.
HPV. It stands for human papillomavirus, a sexually transmitted infection that we now know is the primary cause of cervical cancers. As the National Cervical Cancer Coalition opened its second annual conference, leading health experts presented scientific findings about recent breakthrough vaccines that can now block 70% of high-risk viruses from developing into cancers. The problem is that too many women still do not know about the vaccine. Even scientists like Kathy Hageman, an expert on the HIV/AIDS virus, didn't know about HPV and its new vaccines.
I was diagnosed in February with a stage 1B adenocarcinoma, which is the more rare aggressive form of cervical cancer, and within 2 months underwent a hysterectomy. I had a strain of HPV that would have been protected in the current vaccine, and no one should have to go through a radical hysterectomy.
Another topic of importance: to raise public awareness about the need for regular Pap tests, the screening procedure that is quick, painless, and very effective in detecting HPV-caused cancers early when the disease is most treatable. Here again, the problem is many women do not know about or follow medical recommendations about regular Pap testing.
About 60% of the women who get cervical cancer have never had a Pap smear or have had Pap smears very infrequently in their lives.
And that is a potentially fatal gamble. Speakers at the conference also recommend that women, no matter how healthy they may feel, should have their regular Pap test and HPV test when indicated by their clinician. HPV-caused cancers can grow undetected for a long time.
I've had patients who were in monogamous relationships for 10 years, and all of a sudden they have a wart, and they want to know what is going on. Is my partner unfaithful? We don't know, but we know that the virus can be in our bodies for many, many, many years, and all of a sudden just cause an abnormal Pap or cause a new wart.
In short, while most strains of the virus disappear spontaneously and neither women nor men know they were ever infected, sexual abstinence is the only certain way to entirely avoid risk.
At least 80% of all of us, men and women, get HPV at some time during our lives. And I think that if you look at just people who are sexually active during their life, it probably is much higher than 80%.
The vaccine is recommended for girls as young as 9 years old. It is not effective if a high-risk virus has already been contracted. The National Cervical Cancer Coalition supports HPV cervical cancer vaccinations. Vaccination of girls before they become sexually active could prevent a vast majority of adenocarcinomas, the most aggressive types of cervical cancers that strike women as adults.
It is incredibly important for all women to find this out and for all young girls to be eligible to receive this vaccine. And currently, the vaccine is voluntary, so patients have to go to their doctor. Their doctor either has to recommend it or the patient asks for it.
Nicole Green, a 32-year-old mother of 4, always thought she was taking care of her health until she learned suddenly there was a baseball-sized tumor in her cervix.
He gave me a grim prognosis. He said that I needed a surgery called a pelvic exoneration, and that's where they remove the bladder as well as part of your rectum, and along with all your female organs. And with that surgery, he gave me a 10% chance of a cure. And without it, he gave me about a year or less to live.
You know, she has 4 kids, she's done everything right. It's just, this isn't supposed to happen to you.
But it happens every day. 10 more women will die of cervical cancer before the day is out. And every hour, another woman will be diagnosed with the disease. Survivor Michelle Whitlock came to the conference to inspire. Her cancer was detected in time to save her ovaries, and through a surrogate mom, she's having a baby.
The reality of it is cervical cancer is nearly 100% preventable if we use the vaccine, the HPV test, and the screening tool. That if you get it early and you detect it early, it's nearly 100% curable. And women don't have to die from this disease anymore, and they don't have to lose their fertility.
Push for a PAP. Push for a PAP project.
There were daily breakout sessions as coalition members brainstormed activities to raise awareness in their local communities and discussed ways to enlist the news media in their efforts.
It's all in your kit on the disc. You don't have to reinvent the wheel. And you would send this out to magazine editors. You could send it out to your health reporter at the newspaper.
The outreach toolkit is free and can be requested at NCCC's website. It's information some survivors describe as life-saving.
You know, I was just reaching out, I was doing whatever it took, and that's when I found NCCC online. And it was just like, oh, this was made for me. This is exactly what, you know, I have. That step led me to this whole other life, in a sense. Really, it's changed my life.
Another objective of the conference was to expand the current network of national and international chapters into a grassroots presence without borders. That's vitally important because HPV is the most common virus in America, and there is mounting evidence it is linked to other types of cancers in women and in men. Bob Kahlberg is returning home to Bismarck, North Dakota, and promises to do his part there in memory of his wife, Joan, who died of cervical cancer just last year.
She was my wife, my lover, and my best friend, and I'll miss her greatly.
HPV can be a deadly infectious disease, and much needs to be done. And as the Coalition's remarkable conference came to a close, members left for home passionate about making a life-saving difference. Join the National Cervical Cancer Coalition and make a difference in the lives of women.